Yeah, very good evening to all of you, and thanks to Dr. Partha ARC for putting me among this elite panel of teachers. I left Teaching Institute 15 years back, so my knowledge might be little outdated on this, but little bit we are into this because we recruit around 20 doctors every year. So you can call us, we are end users of these programs, whether it is senior residency or fellowship. So I'll try to put things in that perspective. And this discussion is because of current Indian scenario, because barring few places like PGI and RP Center AIMS, where senior residency also gives you a subspecialty experience, most of our medical colleges, like my colleague has highlighted, the subspecialty exposure is very limited. So probably that's why this discussion has come up. So what experience a postgraduate get if he goes for a fellowship versus senior residency? There is some differentiation. I think fellowship is more focused towards acquiring and refining your diagnostic, surgical, and clinical skills. You are connected to very good mentors who are your lifetime mentors. Who are great clinicians and leaders. And you also get, this is one reason actually I like this topic, because off podium, many times our colleagues, kids and all, we have to advise them. And that's why I said, okay, I'll take up this topic, because we are doing this for last so many years, telling people what to do. So one reason I tell them to go for fellowship is that you get a research experience, which is very useful in their future career. And of course, they get to see best practices going on in these all fellowship institutes, which may be missing in government institutes. So that is one reason a fellowship is good. But on the other hand, senior residency gives you another important aspect of your practice, that administrative experience. And now you are actually running an OR with team where you have residents, you have to keep everyone happy, nurses, your professor, your colleagues, and you have to do the time management, and then there are crisis situation, equipments failing, the key resident not turning up. So these all experiences help you in your future life. So if you jump directly to fellowship and then you land into practice, and then you learn it hard way in your own practice, which you have put up with, lot of efforts and resources. So that's why probably for people, who are not in that much hurry, senior residency before fellowship is a good idea. Also, it gives you a brief exposure to real life situations in practice and in general ophthalmology, that so that you are better prepared to know that what do I learn from fellowship. I've seen like a lot of fellows, they don't even realize that during 3 years of fellowship, what are their goals. They just go through it, run through it, and once it is over, then they realize, oh, we didn't realize, I didn't learn this part, I didn't learn that part. Second is, see, if you are in a good institute, it's easy. You finish your post-graduation and you go for fellowship at same place. But then there are people who do not have fellowship at their place. So they need some time to do this homework, prepare themselves, and find out the best options for fellowships. So again, during that period, senior residency might help them. And of course, some of us are very clear right from the day one of, yes, I have to do retina or I have to do cornea. But other people, actually, they need to see the subspecialty. Like if you have not seen the vastness of oculoplasty or squint, you will probably may not choose them as your subspecialty. So you need that exposure also during senior residency. And of course, if you are aiming for a teaching institution in your career, unfortunately, most of the good fellowships are offered by private institutions, which MCI is still not recognizing as a teaching experience. So that also is a limitation. If you go for fellowship, then probably you can miss that part. So I'll wind up fast. I think this I'm helping Dr. Praveen, that what are the disadvantages of doing a fellowship after senior residency. The biggest disadvantage is that in fellowship, many times you are supposed to appear in a theoretical exam. So after 3 years, that might be a little tough thing to do. Ideal scenario would be that all fellowships should have a senior residency kind of thing club, maybe in the last year, where people can learn about administrative part, non-clinical part. And of course, they can have a junior consultancy, which is mandatory after finishing fellowships, because we are finding problems with fresh fellows. And of course, if MCI recognizes this fellowship experience from renowned private institutions also as a teaching experience, then probably this debate will go down. And to conclude, I think I've already spoken about this, so I'll conclude that it may not be a bad idea. Thank you.
Any comments from the chairpersons about timing of fellowship?